we get a lot of questions, even at the Wellness Hour, but about the cost of dental implants. So what affects the cost of dental implants?
I'm glad you asked that, because that's one of the most common questions we get too, is people call up and they're like, I want to know how much it costs.
Okay.
So I've got kind of a 9 points here that sort of address the issue of cost of dental implants that I'd like to kind of go through and talk a little bit about each one of them. I was recently down in Los Angeles with my son at a basketball tournament. And as you drive down the freeways in Los Angeles, you see these billboards that say dental implant for $299, dental implant for $899. And I look at that and I think, that's crazy. Like you that's what you buy the implant itself for.
That's the cost of a little tiny thing?
And so,
is that right?
Yeah, so that's the first thing I would address, is that little implant that's made out of titanium, that's treated a special way so that we can put it in the jaw. Though those implants vary in cost. Some of the implants, depending on how good your bone are, some implants are specialized because of the position or the location in the mouth that they're going to go. Okay. Some of those implants, they make these mini implants that just have a little O-ball on the top, which we don't really use anymore. They make implants out of zirconia. It's like a ceramic material, which we don't really like. We don't like those implants. We don't use them. The gold standard of an implant is a titanium surface treated implant that'll integrate into the bone.
So that's one part of the cost.
Yep. And so the cost of that specific implant for your specific situation is going to be part of the cost. The next thing that's going to impact the cost is how many doctors are involved.
Okay.
In most offices still, the patient is sent out to another office to have the implant placed. And then the patient comes back and the doctor is now trying to restore and put the crown on the implant. So the more doctors we have involved, typically the higher cost of the implant. In our office, for example, we do everything right there. We not only do the surgeries, but we also do the restorations. We have the lab, we build everything there. And so we can keep it all in one place.
So it's one doctor, one
minimize,
fee.
Yeah, we can minimize the cost in that. The next thing that affects the cost of a dental implant is the big lab bill.
Okay.
When you have to send something out to a third-party lab, you're taking all this material and you're sending some of it digitally. Some things you're having to mail back and forth with the lab. There's a huge cost involved. One of the things that I'm the most proud of is that I have my own lab. I've built a lab where we have a world-class lab in the same building that our surgeries take place. And we can build everything that we're going to put into somebody's mouth.
You say you actually digitally print on a printer in the next room their teeth?
Yeah, we print the teeth during the surgery. While the implants are going in, we then scan and we print a set of teeth that go in that same day. Okay. And so we have a huge savings there. We're not having to send things out and wait for a lab to process a build and then send something back to us. It happens immediately that day.
Is that how it's pretty much done in Montana?
No.
At two different places, what I mean?
Typically in Montana, yeah, there's an outside lab that's involved in building the teeth.
Got it.
The next thing that affects the cost of a dental implant is insurance.
Okay.
A lot of people come in saying, what's my insurance going to cover? How are they going to help out? Unfortunately, with dental insurance, the maximum allowable for a year is typically around $1,500. Insurances haven't changed much over the last 40 years, and they really don't help out when we get into more comprehensive treatments.
What about Medicare, Medicaid, things like that? Not at all?
Same thing, not at all. Yeah, typically they're not going to help out. They're not going to help out at all with something like this. The majority of our patients, we're looking at some sort of financing.
Oh, that's good. So you have payment plans that you set up for them.
Yeah, we're looking at finding a way to make it affordable and make it something that they can have happen without having this disastrous impact.
And these are
there.
Outside lenders, right? So you have to have okay credit to get this done. Is that correct?
Yeah. The better your credit, the better rates you're going to get, the better payment plan you'll have on it. So the next thing, and this I would just send out as a caution to people, is what the teeth are made out of. I see people all the time that tell me, yeah, I got implants. I got teeth that are on implants. I've got the same thing you're talking about. And I question them a little more, and they have teeth that snap in and out. They're still wearing a denture. The differentiation was never made between a denture and a bridge that's fixed and doesn't come in and out, and that's permanently part of their jaw.
Okay.
And so many people get this idea that they're going in to get implants and they're going to get these implant teeth and they end up with a denture.
Like a snap-in denture.
Yeah, a snap-in denture.
Okay.
And that gets advertised all the time. And I have people that talk to me about that all the time that think they were going in to get implant teeth, like what I'm talking about, and they came away with a snap denture. I don't like the snap-in dentures because the patients don't like them. They don't like the way they feel. They still come in and out. They can still get stuff underneath them that hurts.
Okay.
And there's a lot of maintenance on them. There's little plastic pieces in there that snap onto the implants, and those wear out. Sometimes every 3 months we're having to put new hardware in there just so that the teeth will still snap into place. So I don't like those.
Okay.
And so what you're going to end up with as far as materials, what we use is the gold standard. We're using zirconia. We're using zirconia on titanium. Right now that's the gold standard for a full arch restoration. Zirconia is about 10 times the strength of natural enamel. The titanium binds all of the implants together and gives us a strong support underneath. And we just don't have issues with it.
So they should last as long, just like regular teeth. If you take care of them, they're going to last as long as you last.
Yeah.
Is that right?
Yeah, absolutely.
Maybe even longer.
Yeah, because you can't get cavities on them.
Okay.
Yeah, but probably one of the biggest reasons
And they
people
don't
lose natural
stain
teeth.
for the most
No,
part?
your teeth stain because they're porous. But when we put these zirconia teeth in, they're a solid material. You know, they're solid, they're glazed, they're smooth, they clean easier. Your gums get really healthy against them. Yeah, they work really nice. The next thing that can affect the cost is the warranty. We stand behind everything we do. We're going to make sure that everything that we put in your mouth works, that it's functional, you can eat whatever you want, and that you're happy with how it looks and how you're able to chew with it. The last thing that affects the cost of it, I would say, is the experience and the training of the doctor that's doing the procedure. These big implant procedures are extremely complex. There's a lot that goes into the surgical part of them. There's a lot that goes into the restorative part of them to try and make a smile look good, to maintain the proper dimensions of the teeth and what the spacing is and everything on them. There's a lot involved in that. And we all have to start somewhere. I still remember my first case. I told the lady it was my first case. I gave her a discount. I said, hey, let's do this. And she was like, all right, let's do it. But you want to make sure that when you're going to somebody that you kind of know what's their background, what's their training.
You've done thousands of implants, is that right?
Yeah.
Okay.
Yeah, and you maybe ask them how many of these they've done. You know, you may not want to be their first time. You know, and so once a dentist has spent the time, the money to do the training to learn this, it's extremely complex. It's extremely expensive to be able to set up to do something like this. It's going to affect the cost of the implants.
So when somebody calls on the phone and says, hey, how much are dental implants? It's not that easy.
No, and it happens all the time. And they want us just to say, okay, it's X.
But that would be misleading.
Right, it would be misleading. And that's what I think about, like billboards and stuff. When you see a price up there that says dental implants this, there's no way you can know. Everybody's different. There's all these factors that are involved. The best thing to do, and this is why we do it, is to come in and talk. Come in and talk to me.
And you'll give them a price right away.
Absolutely. Once I see some imaging and I see what kind of bone and situation you have, let's talk. I've actually had people that wanted a dental implant consult, and they came in, they just have crooked teeth. They need braces. They don't need any dental implants. So the cost of them for a dental implant is zero. So when people call and ask that, it's really difficult to sort of take all this that I've just talked about and condense it down into saying,
so the only
please come in and talk to us.
Come in.
Yeah, please come in and talk to us. Just come sit down with us and we'll do a consult. We'll talk it all over. We'll let you know where you're at, where you can be, and all the steps that it take to get there.